Hi,
Hi.
friend.
Hello. How are you?
I'm so good. How are you?
Good. Can you hear me okay?
I can. We'll
All
try
right.
this. We'll try this without headphones. It's pretty quiet over here at the end of the day.
Perfect. Same here. I'm like the only one in the office right now, so
Yeah, I hear
we'll be
the
good.
girls out there sorting breast implants, but
Perfect.
we're
Hi,
good.
everyone. Thanks for joining us.
Thanks for joining, guys. This is cool. It's like I'm looking forward to this every week. It's like we get to catch up more than ever
I know. It's like we're hanging out for real, but not really.
in front of a bunch of people, which is
I know.
awesome.
Well, so today we are going to be talking about burnout, physician burnout and wellness and
It's a great
work-life
topic.
balance and all of that stuff, which is a good topic, I think, because we don't really talk about it. Doctors don't
We
talk
don't.
about it,
I mean,
and
and
it,
that's
it's
like
a big problem.
yeah, that's like what's most important is to to talk about it so we know what it is so we can recognize it in ourselves and our friends and support people to make better balance and make a better wellness, profile for themselves so that they don't end up
Right.
going down a dark road. And we see this time and time again.
Yeah, we see it all the time. And I think as plastic surgeons, historically, we've been pretty good. Like our numbers have been below average until the past few years, where, we're up to 40-50% of
I
plastic
know.
surgeons are
Yeah,
experiencing some sort of burnout, which is
right.
crazy because you talk to any plastic surgeon and they're happy, they love their lives, everything is great, but that's not really the reality, unfortunately.
Yeah, I mean, people just get like emotionally exhausted and they sort of lose their passion and they're just kind of going through the motions. And I think I see it a lot in people who are at bigger institutions or who have sort of a practice where they have less control. And
Yeah.
so you just feel like you lose control of the patient experience and the ability to help people and sort of all the reasons why we went into medicine to do
Right.
these, to help people. And um, here you are. Yeah, that's what I did last week too. When
I know, I'm waving at everyone.
I waved at someone and then I totally flipped my camera.
I might
But
do that.
your office looks great. Can you flip it back?
Oh, sorry, I did flip you. I didn't even realize. I don't know how to. Wait, how do I do this?
It
I
was
don't even see
somewhere that I
her.
figured it
Wait
out.
a
Down at
second.
the bottom right hand corner, there's like the arrows. There's like a
Oh, I
little
see. It's on the
rotational
top.
arrows.
Oh, I didn't even. Sorry, I don't even know what you were looking at. Okay.
I was looking at your
Yep,
office,
nothing.
but it's nice. Yes.
Sorry. I didn't even realize I was too busy waving.
It's okay. I was doing that last week too. Now we've learned. We're learning so much.
I know.
But yeah, I
So what
mean,
were you saying? Yeah.
it's a scary thing, and I mean, I've certainly been there myself, and it's kind of like you just kind of get fed up with things, and you're kind of complaining about the same things day in and day out, and even things like the medical record just get like so obnoxious that we're spending so much time doing these things and working on numbers. You have to see this amount of patients, and you lose sort of the joy of what made us go into medicine. And I think it can happen in any job, but we see it a lot in medicine.
Yeah. Well, and I think with the medical record, transitioning from paper to electronic, I mean, there's literally been so many studies where that was really kind of the transition point where burnout increased, because you're taking, we all did this. We all went into medicine to take care of patients and do the clinical aspect. And, more and more that is taken away from us as we're just overburdened with paperwork,
Yeah.
and it makes it harder for people that are a little bit further along in their careers, that have established practices that are new to computers and electronic stuff to make that transition. There's definitely been, it's definitely been, that as a cause, I think, as a primary cause.
And I'm glad that they're like teaching and talking about these things at medical schools because then students and residents are sort of aware of these things and it's a topic that's becoming more of a hot topic and less taboo to talk about. Even physician suicide, you see trainees and physicians who are faculty members um, get so depressed and suffer so much from anxiety, which is so common in our field. I mean, we're all perfectionists. We're all trying
Mm-hmm.
to, we're taking care of people and dealing with people's lives. And that takes a toll. And so it's so important that it's okay to talk about it, and it's okay to ask for help. And I think the most important thing is to notice it in your friends and your colleagues and be comfortable enough that you could speak up to someone and tell them, hey, I'm worried about you. I notice a change. Have you ever done that?
I haven't. I don't know if I've ever really felt like I mean, I personally was experiencing it.
Yeah,
I don't
yeah,
think I had recognized it in
and
anyone
others.
else, you know?
Yeah,
But, you know, the great thing about our society, which when Jeff Janis was the chair, the president, you know, he started this whole wellness initiative. So that was like in 2018, I think. And, you know, so there was a wellness committee,
mm-hmm.
you know, there were multiple panels on wellness in our society. So I think it, you know, at least made it, like you said, made it a little bit more acceptable to talk about it. Because the problem with our field, with medicine in general, is that everything that all of our characteristics and traits that allowed us to be successful in medicine and in surgery
Yes.
are like the reasons why we're experiencing so much burnout as a specialty.
Yeah.
You know, it's like
Yeah. Yeah.
you're trained to never say that there's a problem. You're trained to ignore your basic needs. Like I can remember, you know, my first day as a surgery resident, I don't think I ate a protein bar in a stairwell running like up and down the stairs. Like I never once took a break. I don't even think I like went to the bathroom. You know, like
Yeah.
you just are
Yeah.
running and going all of the time. And you don't break scrub in the OR. So you're like scrubbed for 10, 15 hours and you haven't had a sip of water or anything, you know, and that's like how you're trained. But then those are the things that are just so ingrained in you when you're actually practicing that you ignore yourself, you know, to take care of your patients.
I tell all the residents and med students when we scrub out after a case before we go to the next case, I say, you know, I want you guys to eat and pee before I see you again. Because I think if you don't give them that permission to do it, then they don't, you know, feel like they can take that couple of minutes to themselves. Same for all the girls who are breastfeeding. I say, you know, get out of here, go pump, take care of what you need, and come back when you're ready. Because we kind of ignore those needs. I mean, I went into preterm labor because I spent literally a whole day operating. I ate nothing and was completely dehydrated, and totally sent me into preterm labor, which is just wild.
Crazy.
What we do to our bodies. I mean, we're dedicated, like you said, and that's why we do, you know, we're successful at what we do, but it's important to have self-care, and I really try hard to teach that to the residents too.
Yeah.
The one thing I remember, I mean, and we can talk about like what each of us do to stay balanced, but the one thing I remember my mentor, Nicole Summer, doing when I was a resident is that when I would look on her schedule, she would schedule and put things just on her schedule so everyone could see. Like it was really important for her to take family birthdays off so that they could have family time together. And she would put that right on her schedule. It would say like Eric's birthday, half day. And so I started doing that when I had the residents. I would just show them that it's okay to like take time for yourself, or, you know, do whatever you need it is for self-care to take care of your family. And a lot of them sort of commented on it too. And I think that's like it's a good little token that they can take with them, that that's okay, you know, to value other things in your life.
Right. No, I think that's great that you're doing it. And that's the thing. They're never going to initiate it on their own, right? At least the residents. I mean, during cases when I had residents working with me all the time, I had to, you know, like if there was a moment where they weren't actively doing something and we'd been scrubbed for 4 or 5 hours or however long, I'd just be like, okay, go take a break, go have a snack. And they don't move. They usually just stay there for a while. And I'm like, I'm not kidding. This isn't like, you know, I'm not trying to trick you. Like, go. You're not doing anything. Go get some water and go to the bathroom and come back. But you kind of have to force that and teach them. Like, just as most of us learned all these negative behaviors, you kind of have to teach them the positive ones, you know, that they can take forward.
Yeah.
With them.
What kind of things have you done differently? What kind of things are you doing differently now in private practice that now that you have sort of control over that balance?
I mean, well, I have complete control over my schedule, like
Yeah.
100%, you know? So if I don't
Yeah.
have a patient scheduled until 10 o'clock, like I'm not going to come, you know, I do other things. I'll go work out or I'll work from home or do whatever and come in when I need to. So, I mean, I think from what I've gathered from, you know, talking to Jeff Janis and being part of this committee and, you know, seeing how, like, burnout is very individual and very personal, you know, and it looks different on everybody, even though we have the traditional like three things to look out for. What is it? Exhaustion, lack of efficacy, you know, loss of empathy or
Hmm.
depersonalization. It still looks different in everybody.
Oh yeah.
And the way that people deal with it is very different. You know, I know some people, you know, I feel like the answer is everyone has yoga time. You know, that's how you're gonna like that's how these like conversations were going. Well, just we'll have yoga in the hospital, you know, for an hour a day. But
Yeah.
that that actually may cause more stress to somebody
Yeah.
because they feel like they have to do it.
Hmm.
So, you know, for me, it was just the common theme was just a loss of control, I think, when it comes to, you know, anybody's stories, right? You just don't have control. And so for me, that was my main issue when I was up in, you know, my previous job. And so I have 100% of control now. So I'm working a lot harder, but I don't feel burnt out. Like I enjoy doing what I'm doing, you know,
Yeah.
which is very, you know, it was very different. The way that burnout looked like on me, I was questioning whether I even liked plastic surgery or whether I picked the right field. You know, it's
That's so scary. Yeah.
yeah. And I didn't know what it was, right? Because we never learned about it. You don't learn about it in residency. Like everything was perfect, even though you
Right.
hadn't slept for 40 hours. Everything is just so is great. And
I
so
wonder
I
if that's
remember,
why we lose residents. I wonder if residents are leaving, you know, when residents
yeah,
change fields. I wonder if it's really, it's not necessarily that they don't like the field, it's just they're so burnt out, you know, with life and the limited amount of time you have as a resident
yeah.
that they sort of lose that focus.
Yeah, I think that's 100% it. And
Yeah.
then you lose like, you know, like you said, you lose that focus and you lose the very reason why you decided to go into medicine
Mhm. Mhm.
or be a plastic surgeon, right? I mean, we don't make these decisions lightly. I think every one of us that chose this field put a lot of thought into it, you know, before taking the plunge. And then so to so quickly just jump ship, I
Yeah.
think you just kind of lose perspective and you're just inundated with so much external stuff that you lose sight of why the fundamental reason of why you did it to begin with,
Yeah.
you know?
Yeah.
But yeah, I think for me it was just getting that control back and doing the cases that I wanted to do, you know, just like little things like that. I mean, in Boston, I was pretty good about work-life balance. You know, I hated being at work, you know, so I like didn't have any control at work. So when I was not at work, you know, I spent a lot of time running. I joined a running group. I did all of these. So personal life was great. It's just I wasn't happy with my career, you know.
Yeah.
So you just
Yeah.
kind of have to take things into your own hands a little bit.
Yeah, I agree. I think there's something different between balance and burnout. Like, I think I've always done a really good job of being balanced. And I think I had good mentors who taught me that. And, like, it was
Mm-hmm.
important for me to carve out family time. Once we had our second kid, we started date nights because there was just like, there
Yeah,
was
you did
just
it every Thursday, right?
you got it every Thursday. And so there was literally like no time for us because we were just like coming home and changing diapers and answering pages and alternating call, and we just weren't talking. And so we started date nights. We decided to take the birthdays off because I ended up doing a really late case for my son's second birthday, and I got home and it was like bedtime, and I had missed the whole day. And I cried and I said, I'm never doing this again. You know, I love my job, but I love my family. And so from then on, Tom and I have always taken half days on birthdays, just like Dr. Summer used to do. So
Mm-hmm.
we did a pretty good job of that. I mean, I even was very protective about some administrative time, which I think is so important for people who are starting in practice because there is so much stuff that is not medicine that we have to do, and that, you know, those are metrics we have to meet, and we get penalized if we don't. And so I always carved out some time to do the things I needed to do. Um, but I still was burnt out. I was dissatisfied with the patient experience. I was dissatisfied with the limitations on my practice.
Mm-hmm.
Um, and those were things beyond my control. And then, you just flip a switch, and for me, changing to private practice, just like you, gives me
Yeah.
control over all of those things and so much joy. Like I just have so much joy in what I do again.
Yeah,
It's so
I mean, it's
cool.
a great feeling, right? It's so
It's
rewarding, and
like,
it reminds you of why we put all of the
exactly.
work into it, right? We spent decades trying to get
Yes.
here, so it would be a shame if we didn't enjoy every second of it.
I know. And we can talk about like our transition in private practice and stuff another time, but like the first literally like month I was in private practice, every night I would come home from work and be like, Tom, I'm so happy. And he's like, I know. You tell me every day. And I'm like, I know, but I'm like, I just come home from work and I'm so happy again. And like, that's what we felt like when we were students, and we were
Yeah,
like, oh my God, we found this field we're so passionate about. So it's so cool that when you can finally control your environment, you can be passionate about what we worked so hard for.
exactly. Well, and the thing is, control is a huge part of it, but I mean, in residency,
You
you had
can't.
zero control over anything.
Yeah.
But I still remember, I mean, I loved plastic surgery. I was happy to be there. I was happy to like put in the work and be the best that I could be. You're in there with your friends, your
Hmm.
co-residents. And so, there was not one day where I really questioned my decision, but it was really afterwards when you're in real life, and you're not just operating all the time. We all know we love being in the operating room, right? But
Yeah.
like real life practice is not just OR
Yeah.
24 hours a day. So it's much different.
I mean, maybe the difference there is that when we're in residency, you and your residence is like a family. There's so much built-in support there that you're kind
Mm-hmm.
of all in it together, and there's sort of some community in that exhaustion, and that,
Yeah.
it's like you're climbing to the top of the mountain, and you know that it's finite and there's an end in residency. And I think that's why it's so important to build communities in plastic surgery, so we have sounding boards and we have that kind of support, and we have people who are close enough to tell us, hey, I see a change in you, and you know let's talk about how things are going, and maybe this is something you haven't even noticed yourself.
Yeah.
So I'm
Yeah.
glad I have you. So if
I'm
I'm
glad
ever
to have
burned
you
out, you tell me.
too. I know, same here. Well, and I feel like we were
Yeah.
painting a bad picture about academic medicine. Even, both of us kind of had the same experience with academics and transitioning to private practice. But it's not the case, right? I mean, it's not
No.
academics. There are so many people that we both know that are so happy. But, like you said, it's community, it's who your leadership is, it's, that kind of stuff that all plays a huge part in it.
Yeah, it's just support. In any environment, you can be supported or not supported. Um,
Mm-hmm.
and we need to be supported as people, not just as surgeons who need a nurse and a secretary, a receptionist. We need support as people to do a very demanding job.
Right.
And it's just important that you find that environment that's supportive of you. And I think sometimes it takes being in an environment that's not very supportive to realize what you need, because you can be super fulfilled and love your job and love the work that you do, but if it's not in an environment that's fostering growth, then it's not a good fit.
Right, exactly, exactly. And that's the thing, and it's different for everybody, right? Some people would not thrive in private practice.
No, they
Maybe
would feel that this is so stressful.
so it's stressful, and they want nothing to do with it, and they'd be happier in an academic practice or a group practice or something. So it's very individual. I remember, sitting there on these committees where everyone's trying to come up with a solution, right? Sorry, my Siri went up. Try to come up with a solution about what can we do to improve burnout. And the fact is, like, there isn't one solution, right? So, like, you can't. I mean, I think there was one point where they tried to have a wellness retreat where people would go for a few days away from their families and all this stuff. And you're just like, okay, well, are you actually adding to all the stress, because now that's just more time away from family and away from personal life, and it's something else that somebody feels like they have to do. So it's very, and some people would love that. So it's just
Yeah,
it's very individual, and I feel like that's where you need people around you to like point things out, because you might not even realize that you're experiencing it. And you also need to just kind of take a step back and reflect, and you know, really think about what's important for you, because what's important for you at the moment may not be what was important in the past, right?
totally.
It changes constantly, so you just have to check in with yourself.
Awesome.
Yeah. All right. What's interesting too is I was looking over some statistics, and it looks like, or you know, the female burnout rate is like 10% higher than men.
Yeah, that's not
Yeah,
surprising.
yeah, I
I
know.
think, I think, I mean, I think we just need to ask for support, just like we ask for support at work. I think that there's just sometimes there's more demands on us at home too, and we're kind of pulled in different directions. And really the best advice I have for women, and what people told me, like when I joined Women in Plastic Surgery group, was that um, you want to offer and give as much support for your family as you can and as you can afford. And the more supported you are to take care of your kids and your house and things, the more support you have to do the things that aren't really important, then the more time you have for quality time with your family. And I really took that to heart, and I really try hard to do that. And it's fulfilling, because then I'm never home doing things where I feel like I'm kind of wasting time. When I'm home, I'm with my kids, and
Mm-hmm.
I'm with my kids, just really spending good quality time with them. So I always
Right.
sort of tell the residents that I think that's really good advice, to just, you know, get as much support as you can, so that the quality time that you have is truly quality.
Right. Yeah. No, that's perfect advice. Your residents are lucky to have you.
Oh, they're the best.
Really.
They're the best. I'm so grateful that, even though, I'm private now, that I get them 6 months out of the year. So it's like
Yeah, that's
amazing.
amazing. Yeah, that's
I
really
have one
great.
now, I have one next month, and then I have two students with me this summer too. So it's cool.
Oh, really? Oh, that's
It's
really
fun.
nice.
It's
Yeah,
fun.
it's fun. Well, I feel like, there's still not a lot of people like you, perhaps, attendings that, or, like Nicole, that really stresses balance and putting your personal life. Like, it's okay to put that first. So I feel like that is good for those kids to learn about. And,
Absolutely.
you know, it's been ingrained in us for like decades to never
Yeah.
care about our own health
hmm
and our own basic needs. So
I mean, and then the other
perfect
thing is,
advice.
if you don't stand up for yourself, no one really is. No one's going to tell you you need a day off, that you need some administrative time, that you should, really be with your family on a Saturday.
Mm-hmm.
No one's going to say no to the things, and no one's going to carve out that time but you. And so you have to just make it a priority, and stick with it, and not apologize for the choices that you make. And that's hard. I mean, I don't do a good job at
And
that
that's
either.
really hard.
Yeah.
Yeah. I mean, I think, well, we just apologize by nature, right? Women say sorry. What is the percentage? Like, I don't even know, but substantially more
Yeah.
than men. But I mean, we kind of need it. Have you heard that analogy about the energy bank account?
Uh-uh.
Or so there used to be an analogy that described burnout as a battery. So when the battery runs out, burnout is like the battery running out. But the problem with that analogy is when the battery runs out, like the toy stops working, right? So it's just done. So they are, so the new analogy is that it's an energy bank account. So every time you withdraw, you're, withdrawing energy, which is fine, but you need to put in deposits, and those deposits are time spent with your family, or exercising, or traveling, or whatever it is that you enjoy doing. But then the problem is, if you never put in deposits in, and you're constantly withdrawing, then you have a negative balance, because you're
Negative
still
balance.
going
Yeah.
like deeper and deeper in.
Yeah.
So I always like that, because it's
I love it.
it's so true, right? And the problem with physicians having burnout is not only is our suicide rates are higher than the general public, but it affects our patients directly, right? At the end of the day, like we're making life and death decisions, you know, maybe not so much in plastic surgery, but as a
Yeah.
specialty as a whole,
Yeah.
right? And it affects patient care. So, you know, we have to focus on ourselves as well.
Awesome.
Yeah. All right.
Well,
Well,
I'm going to think about this talk. It's good.
yeah,
I'm
exactly.
going to put
Well,
some
it's always
energy
so much
deposits in the
fun.
bank.
I know,
I
the
love
placement
it.
in the bank. It's so good. It's so perfect.
All right.
All right. Well, so I guess we played around with the evening time. Next week we're going to do Friday, possibly.
Yeah, we'll check that out and see. We'll just keep changing it up and see. We'll just, you guys just talk to us, tell us what time you like better, what works, what topics you'd like to see.
Yeah.
And we'll play around with it until we get the perfect fit.
Sounds good. Well, thank you all for
Awesome.
joining us.
Thank you, everyone, and tune in on Instagram TV and check it out.
Absolutely. Ashley, always good seeing you. I miss you, girl.
All right, love. This is fun. I love it though, because we still get to talk like every week. It's amazing.
I know. I know. All right. Love you.
Awesome. Love you
Bye.
too. Bye, Smith.
Bye, guys.
Bye. See ya.